So can someone attempt this question? What's your diagnosis?
Inflammation.
Hypertrophic. Hypertrophic.
Look at even with a heel scalp about 13 months. What do you think?
Okay. Keloids.
Exactly. So what's your differentials?
Hypertrophic.
That's one. What else again?
Neurofibromatosis, I think.
All right, that's right. That's one differentials. Okay, can we have that on that one again? Okay, so hypertrophic scar is a differential, neurofibromatosis is a differential, dermatofibrosis protuberance, and other differentials. So what are the risk factors that may predispose to a patient to having keloids? Can we answer the guess? Being black is a risk factor. Being female is a risk factor. Being blood group A is a risk factor. Family history of keloids is a risk factor. So these are some of the risk factors that can predispose one to having keloid. Then another one, okay, that one is usually for hypertrophic scar is chemical bond, but that's for hypertrophic scar, not for keloid. So what treatment options do we know that can be used to treat keloid? I want us to answer this question together.
Steroids.
Yes, that's one option. What are the options again?
Excision.
Sorry, I'm not hearing.
Excision.
Yes, and the type of excision is called intralesional surgical excision, intralesional excision, or intralesional surgical excision, or simply put, intralesional excision. That means you excise this keloid within the margins of the tumor, or the keloid rather. That means if I'm to excise this, if I'm to do intralesional excision, I'm going to exercise it like this. You can see my cursor, right? Can you see my cursor?
Yes.
So this I'm going to exercise it. And the margins within the tumor or within the keloid. After excising it, I'll then close the wound. This pattern of exercise, you exercise V in a V fashion down. They then close the remaining. The essence is that if you exercise at the margin, you're going to create more severe keloid for you. So that's on that option, traditional excision, steroid. What other options we can apply in treatment of this condition?
Triamcinolone injection is also steroid, right?
And that's triamcinolone. The steroid is triamcinolone injection. That's steroid. So what else again?
Radiotherapy.
Sorry? Sorry? Okay.
I said radiotherapy.
Exactly. Can you use radiotherapy for it again? And what else again?
Laser therapy.
Yes.
Laser therapy.
Yes. That's an option. Then you could use cryotherapy. Again, let me list the options for easy remembrance. You could use steroid triamcinolone injection, precise triamcinolone injection. You could use intralesional excision, that's surgical. You could use radiotherapy for it. You could use cryotherapy for it. Okay. So that ends this question. Is there any question you want to ask again in this for this slide?
So, Doc, we use
think-
excision, laser therapy, and cryotherapy.
Again, let me come again. Steroid, precise intralesional excision. You don't use laser. Well, laser, I'll talk about laser, intralesional steroid, precise intralesional excision. Sorry, intralesional steroid, precisely triamcinolone injection, surgery, precisely intralesional excision, radiotherapy, cryotherapy. Use of laser perceiving keloid.
So radiotherapy.
So there's radiotherapy. Use of laser in keloid is controversial. In the sense that laser helps to soften the scar. So it's not widely, commonly a modality accepted generally. Yes. So, but it's laser. I'm aware that there's laser in treatment of keloid, but there are issues with it. So, for your examiner, who I'm very sure has not seen one, please discard laser. You understand?
Please, I have a question. Yes.
Okay.
Can someone have like two of these this kind of scar? We used to call that keloid, or would you say now it's neurofibromatosis, or you have to have a cafe-au-lait spot with this scar, then you can call it neurofibromatosis?
Please come again with the question again. I wasn't hearing it properly. Come again with the question, please. Could you repeat the question again, please?
Sorry, I can't hear you. Your network, please.
I said, could you repeat the question again?
Okay, I'm saying we're seeing this, there is one scar, one big scar, we're calling it a keloid. So if this person has more than one of these, like let's say 2 or 3, would you now, without, the person doesn't have the cafe-au-lait spot and all the other diagnostic criteria for neurofibromatosis 1, will you still say this is a keloid diagnosis, or will you say it's a neurofibromatosis diagnosis?
Okay, fine. That's a very nice and brilliant question. Now, most times, when they give you a picture like this, it will be unfair for the examiner, or it will not be proper for the examiner not to give you clues.
Okay.
For instance, look at a patient with a healed scar about 13 months. And why use what 13 months is that is to help you differentiate it from hypertrophic scar.
Chief, what's the basic difference?
They're almost the same thing. Difference is histological, they're almost the same histological, but the difference is this. In keloid, it usually grows beyond the margin of the wound.
Yeah.
In hypertrophic scar, it remains within the margins of the wound. It doesn't grow beyond it. That's one difference, right? Hypertrophic scar usually by 6 months to 1 year it resolves, but keloid will extend beyond a year. Usually by the 6 month, hypertrophic scar starts regressing. By 1 year, it becomes flat. But for keloid, by 1 year, it keeps still growing. Hence, I use what 13 months to divert your attention. So again, just hold on for some comment. Okay, so again, for keloids, usually very itchy. Hypertrophic scar itch may be there, but not as severe. But classically, keloid usually extend beyond 1 year, and the keloid grows beyond the margins of the wound. while hypertrophic scar remains within the margins of the wound and usually less than 1 year. That's the basic difference. Having said that, to answer the question that was asked earlier on, now, if they give you something like this, they will always give you a cue to help you differentiate. For instance, the cue may just be in the questions like if you want to give you neurofibromatosis, they may say, okay, what investigation will you do? That will help you know that in keloid you don't need to do you may just say someone that has this swelling and then a complaint of headache, what investigation will you do? You know that that's about neurofibromatosis type 2. So most times it will be in the question, they give you a cue that will help you tear it apart and not just plain picture. And if they give you a plain picture anyway, for neurofibromatosis it's usually nodular. Why for hypertrophic scar or keloid, it's usually not nodular. It's usually cauliflower or grow along the body plane in terms of and usually around the wound. I don't know if I answer your question the way you really want it.
Yes, thank you.
Okay, so is there any other question in this for this slide again before we move forward? Okay, so I'm assuming we're moving forward now.